everyone, welcome to Dr. Tutshine, and this is the prosthodontic series of fixed partial denture. In this video, we'll talk about one of the components of fixed partial denture, that is Pontic. So what is Pontic? Pontic is an artificial tooth on a fixed dental prosthesis that replaces a missing natural tooth and restores its function and fills a space previously occupied by the clinical crown. This definition is by Glossary of Prosthodontics. In this video, we will talk about different designs of Pontics. So this is the classification is given by Rosenschel of Pontics, and this classification is depending on mucosal contact. Okay, whether the Pontic is in contact with mucosa or whether it is not in contact with mucosa. So there are two types. One is with mucosal contact and the other one is no mucosal contact. The mucosal contact Pontics are saddle ridge lap, modified ridge lap, ovate, conical. The other type is non-mucosal contact that includes sanitary and modified sanitary. Now we will talk about each of them one by one. Each type of Pontic has their recommended indication, contraindication, and advantages, disadvantages, and the material used for the fabrication of Pontic. First, we will talk about one of the type of Pontic that is not in contact with mucosa, that is sanitary. The recommended location for this type of Pontic is posterior teeth, and it is indicated in case where there is non-aesthetic zones, that is usually posterior teeth, and it is indicated in case of impaired oral hygiene. You can see this sanitary type of Pontic, and it is contraindicated where aesthetics is important. It has advantages like good access for oral hygiene, and it has one of the disadvantages, that is poor aesthetics. The material used for this type of Pontic fabrication is all metal. The other type we will talk about is saddle ridge lap, and it is not recommended, not indicated, and it is contraindicated. Why? Because it has disadvantages like poor oral hygiene, but it has advantage. One of the advantages, that is aesthetics, and the material used is not applicable for this type of Pontic. The other type is conical, and the conical recommended location is molars without aesthetic requirements. The contraindications are where minimal aesthetic concern exists, and it is indicated usually in posterior areas where aesthetic is of minimal concern. Disadvantages: it has poor aesthetics, and the advantages are good access to oral hygiene. The material we can use for this type of Pontic fabrication are all metals, metal ceramic, and all resin. The other type is modified ridge lap, and it is one of the type of Pontic that is in contact with mucosa. It is recommended usually in high aesthetic requirements like anterior teeth, premolars, and some molars. The indication it has good aesthetic concerns. Contraindications: where minimal aesthetic concern exists. Disadvantages: it has moderately easy to clean, and the advantages: it has good aesthetics. The material used for this type of Pontic fabrication are metal ceramic, or we can use all resin or all ceramic. The other type is ovate. It is one of the type of Pontic that is in contact with mucosa, as you can see. So recommended location for this type of Pontic is where high aesthetic is needed, like maxillary incisors, canine, and premolars. Indication: where there is desire for optimal aesthetic, like high aesthetic line. It is contraindicated in case the patient is unwillingness for surgery residual ridge defect, because this type of Pontic requires surgery for its fabrication. So it has also disadvantages like it requires surgical preparation, so not for the residual ridge defects. It advantages that it is superior aesthetics and it is easy cleaning. The material used we can use for this type of fabrication of Pontic are metal ceramic, all resins, and all ceramics. Thank you for watching this video. If you like, share, subscribe, and comment.